Hello and welcome. In this session, we'll explore LO3. Be able to conduct budgetary processes in health and social care organizations and discover how healthcare organizations manage their finances effectively. Budgets are financial plans that guide organizations. They include income, expenditure, and capital usage. In healthcare, budgets ensure resources are used efficiently. Different types of budgets, like fixed and flexible, serve various needs. Understanding these is vital for effective financial management. Healthcare organizations use various budget types. Long-term budgets plan for future needs. Short-term budgets address immediate requirements. Flexible budgets adapt to changing circumstances. Each type serves specific organizational goals. Zero-based budgeting starts from scratch. It requires justifying all expenses. This method promotes efficient resource use. It helps organizations cut unnecessary costs. Zero-based budgeting is particularly useful in dynamic environments. Budgetary control is essential for management. It involves planning and coordination. Organizations divide into budget centers. Each center has its own budget. This approach ensures overall objectives are met. Monitoring budgets is crucial for accountability. It compares budgeted and actual figures. Variances are analyzed for corrective action. This process ensures financial goals are met. Continuous monitoring enhances financial performance. Budgeting affects human behavior in organizations. Employees may resist budget constraints. Communication is key to overcoming resistance. Involving staff in budgeting promotes acceptance. Understanding human factors improves budget effectiveness. Master budgets consolidate all functional budgets. They present a comprehensive financial plan. This includes sales, production, and capital budgets. Master budgets align with organizational goals. They provide a roadmap for financial success. Setting targets is crucial for budget success. Targets should be realistic and achievable. They guide organizational efforts. Clear targets enhance motivation and performance. Effective target setting leads to better financial outcomes. Waste and inefficiency impact budgets negatively. Identifying these areas is important. Implementing corrective measures saves costs. Continuous improvement is key. Efficient resource use enhances financial health. Case studies offer practical insights. They show real-world budgeting challenges. Learning from others' experiences is valuable. Case studies provide actionable solutions. They enhance understanding of budgetary processes. Financial statements are vital tools. They provide a snapshot of financial health. Analyzing statements aids budget preparation. They reveal trends and performance indicators. Understanding statements enhances budgetary decisions. Budgets can motivate employees. Clear goals drive performance. Involving staff in budget setting boosts morale. Recognition of achievements enhances motivation. Effective budgets align personal and organizational goals. Evaluation is crucial for improvement. It assesses the effectiveness of budgeting. Identifying strengths and weaknesses is key. Continuous evaluation leads to better processes. It ensures alignment with organizational objectives. Understanding budgetary processes is vital in healthcare. From planning to evaluation, each step matters. Mastering these processes ensures financial success. If you have questions, message us on WhatsApp at 074-8436-1688. See you at the next session. Thank you for your attention.